Hello, and welcome to this week's IRQTC Quick Tips video. I'm Brian Traskos, the founder and director of the Institute for Rehabilitative Qigong and Tai Chi. This week and over the next few weeks, we're going to be talking about Qigong for pulmonary health. Now, you might be wondering, what is Qigong exactly, and how can it be helpful for people dealing with conditions like COPD, IPF, pulmonary hypertension, and asthma? Well, Qigong could be described as a self-healing and wellness practice that originated in China about 5,000 years ago. And if we look at the word Qigong, we can get a better understanding about what's happening when we practice these kinds of things. Qigong is spelled Q-I-G-O-N-G. The first part of this word, Qi, is the word that the ancient Chinese would have used for universal life force energy, or the energy that animates everything in the universe. Now, interestingly enough, it's also the word for breath. So breath and energy are synonymous in this Qigong paradigm. Through their observation of nature, the ancient Chinese noticed that things that were animated tend to be breathing. Very interesting when we start to consider pulmonary health. The second part of this word, gong, might be translated as practice, nurturing, cultivation, or maybe even work. When we put these two halves together, Qigong, we end up with something that means breath practice, breath nurturing, energy cultivation. In other words, we're doing something mindfully with the breathing in order to cultivate the energy that drives and animates life. That's really the essence of a Qigong practice. Now, Qigong has what we call 4 baskets. 4 baskets of separate practice that are included in a Qigong practice as a whole. The 4 baskets are gentle movement, breathing, meditation, and self-massage. Now, we know that each one of these practiced separately has positive effects on our physiology. However, when we put them all together, their positive effects aren't only additive, they're actually exponential in nature. Think about it like this. If we had chicken stock, carrots, celery, and onions, each one of those things in and of itself would have positive effects on our physiology if we consume them, assuming we weren't allergic to them. Right? We know that those things are good for us. Now, when we put them all together, we get more than just chicken stock, carrots, celery, and onions. We get a chicken soup. And each one of those things, the way that they taste by themselves, we put them all together, they taste completely differently. And they taste amazingly wonderful, and they're incredibly healing for the body. So we might think about Qigong as being the chicken soup of all these separate parts. When we put them together, we end up with these phenomenal effects in our body. Now, we know that when people with pulmonary conditions practice things like Qigong, or its close relative Tai Chi, that we do see improvements in lung function, like forced expiratory volume, vital breath capacity. We also see improvements in 6-minute walk times, lower extremity strength, enhancement in balance, as well as decreased depression, anxiety, and an improved quality of life. So we do know that research does bear out how positive and powerful these things can be when we practice them regularly, especially when we have pulmonary health conditions. So let's talk about how to do a very simple Qigong practice. Over the next few weeks, we're going to take one Qigong practice, and we're going to build each one of these components into it so that you have an opportunity to practice and experience what Qigong can be like for you. So let me just move this out of the way. We're going to talk about movement this week. Before starting any Qigong or Tai Chi practice, we want to consider posture first. Posture is very important. And whether it's sitting or standing, our posture is essentially the same. A very quick overview of our posture. You want to be able to feel your feet on the ground. I'm going to turn to the side so you can see my spine for this. You want to be able to feel your feet on the ground, feel connected to the ground, whether you're sitting or standing. Relax your knees so that they feel kind of bouncy. Now, bring your awareness to your low back, to what we call your sacrum right here. I like to imagine I have a long dinosaur tail about 20 feet behind me, and I could do essentially 3 things with that dinosaur tail. I could pick it up in the air and stick it way up there, and that would be arching my back. I could squash that tail on the ground, and that would be rounding my back and squeezing my abdominal muscles. Or I could take that dinosaur tail, lift it up slightly, and then just allow it to rest on the ground. And when it rests on the ground, my spine comes into what we call a neutral position, where it's nice and long. It's neither curved backwards or curved underneath. Okay, so it's just nice and long in the center position. Next, I bring my awareness to the top of my head, and I imagine lifting my crown up towards the sky so that my spine is both lowering as my tail settles and rising up as my head lifts. This posture, as best we can possibly do it, even if we are feeling fairly flexed forward, the idea is again to lengthen that posture. Imagine getting it long and moving upright as best we can, as comfortable as we can. Moving in the direction of this posture, regardless of if we can actually perfectly do it or not, that doesn't matter as much. If we move in the direction of that posture, we begin to have the opportunity for more efficient breathing. Our diaphragm comes into a better shape and position. Our muscles of respiration are able to work more freely and more easily, and we have more lung capacity to be able to both extend and shrink down with the movement of our diaphragm and our ribs. So moving in that posture is fairly important, and we just do it as best we can. For this Qigong movement we're going to practice, I'm going to show it to you sitting down. I'm going to feel my feet connected to the ground, my knees relaxed, my dinosaur tail settled, and my head lifted up toward the sky as best I can. This movement is called flowing motion. Very simple. Hands rise up to about the level of the shoulders or head, and then hands turn over and drop back down towards the ground, coming behind my waist, and then scooping again and rising. So just lifting and falling down again. A gentle movement practice, very easy. For breathing this week, just breathe in whatever way feels comfortable for you. You can certainly do this with or without supplemental oxygen. Breathing in whatever way is comfortable. Practice this week, just gently moving in this flowing motion. Lifting hands up as high as you comfortably can. This is fine. If that's as high as you can lift, that's wonderful. If you can lift a little bit higher, that's equally as wonderful. Just practice moving slowly and fluidly this week. Try it several times a day. And then next week, we'll build in a breath practice to go along with this very simple Qigong movement. Thank you for joining me this week for our IRQTC Quick Tips video. If you liked the video, please comment below. Let us know what you think and ask any questions that you'd like. And of course, share it with a friend. Thanks so much for joining me again this week. And remember that life becomes the meaning that you give it. Take care. Bye-bye.